Hello everyone, myself Marangam Sumita, Associate Professor, Army Institute of Nursing, Guwahati. Today I'll be taking a presentation on anxiety disorder, its definition, classification, epidemiology, symptoms, pathophysiology, definitions of generalized anxiety disorder, the risk factors of anxiety disorder, and diagnostic and the clinical presentations of generalized anxiety disorder. To begin with, let's see the introduction. Anxiety disorders are one of the commonest psychiatric disorders in the general population. Anxiety is a normal phenomenon and it is characterized by a state of apprehension or unease which arises out of anticipation of danger. It can be differentiated from fear in that, in case of fear, the person has an apprehension in response to an external danger, whereas in case of anxiety, the fear is unknown. Coming on to the definition, the American Psychological Association (APA) defined anxiety as an emotion characterized by feelings of tension, worries, thought, and physical changes like increase in the blood pressure. Classification: anxiety disorder are classified as generalized anxiety disorder, panic disorder, phobic disorder, post-traumatic stress disorder, and obsessive compulsive disorder. Epidemiology: anxiety disorder are one of the most prevalent psychiatric disorder. According to epidemiological survey, one-third of the population is affected by an anxiety disorder during their lifetime. They are more common in women and during midlife their prevalence rate is highest. Next is the symptoms of anxiety disorder. The symptoms of anxiety disorder are classified as physical symptoms and psychological symptoms. Physical symptoms is further classified as motoric symptoms like tremors, restlessness, fearful facial expression. Second is autonomic and visual symptoms like palpitation, tachycardia, sweating, dyspnea, hyperventilation, constriction in the chest, dry mouth, frequency and hesitancy of micturition, and diarrhea. The second classification of anxiety disorder symptoms is psychological symptoms, which is further classified as cognitive symptoms like poor concentration, distractibility, hyperarousal, negative automatic thoughts. Next is perceptual symptoms like derealization and depersonalization. Next, affective symptoms like diffuse, unpleasant, and vague sense of apprehension, fearfulness, inability to relax, irritability, feeling of impending doom that is usually seen in case of severe cases of anxiety disorder. The last one is other symptoms, which includes insomnia in the initial stages, increased sensitivity to noise, and exaggerated startle response. Pathophysiology. The pathophysiology of anxiety disorder is classified as GABA, noradrenergic model, and 5-HT model. The first pathophysiology, that is GABA receptor model. GABA is the most prevalent inhibitory neurotransmitter in the central nervous system. Evidence shows the link between GABA A receptor dysfunction and the pathophysiology of anxiety disorder. GABA A receptor act as gatekeepers for chloride channel and have multiple modulatory sites such as benzodiazepine receptors. In normal individual, GABA A receptors bind to GABA receptors, hence opening the chloride ion channel and causes hyperpolarization, decreasing cellular excitability. The symptoms of anxiety may be linked to underactivity of GABA system. Social anxiety disorder may be due to abnormal central GABA B receptor function. In post-traumatic stress disorder, abnormalities of GABA A inhibition leads to stress. The second pathophysiology is noradrenergic model. According to this model, the autonomic nervous system of an anxious individual is hypersensitive and overreacts to various stimuli. The locus coeruleus have a role in regulation of anxiety as it activates release of norepinephrine and stimulates the sympathetic and parasympathetic nervous system. Chronic noradrenergic overactivity down regulates alpha-2 adrenoreceptor in patients with generalized anxiety disorder and post-traumatic stress disorder. Patients with social anxiety disorder appear to have a hyper-responsive adrenocortical response to psychological stress. The last model is 5-HT model. The major serotonergic systems originate in the REF nuclei in the brainstem and project to the areas throughout the brain. This projection appears to have primarily inhibitory function acting in opposition to cholinergic, noradrenergic, and dopaminergic projection. Increased serotonergic activity is associated with reduced level of behavioral activation and arousal. Serotonin plays an important role in sleep, mood, appetite, temperature regulation, and pain perception. Now, let's see the types of anxiety disorder. The first one is generalized anxiety disorder. Generalized anxiety disorder (GAD) is characterized by uncontrollable worry and excessive anxiety to a point where it interferes with the daily life of the person. It is associated with muscle tension and impaired concentration and insomnia. And in order to make the diagnosis for a generalized anxiety disorder, the symptoms of anxiety should be present for at least 6 months. Risk factors for generalized anxiety disorder. The first risk factor is sex, in that women are diagnosed with generalized anxiety disorder twice as often as men. The reason behind this may be because of hormonal factors, cultural expectation, and more willingness to visit doctors and talk about their anxiety. Second, family history. Anxiety disorder tend to run in the family. This may be because of family dynamics, such as the failure to learn effective coping skill, overprotective behavior, abuse, and violence. Genetic factors. Approximately 1/3 of first-degree relatives will be affected. Substance abuse like smoking, alcohol, and drug use can increase the risk of generalized anxiety disorder. Medical condition. Here, people with chronic illness have a greater risk of generalized anxiety disorder. Socioeconomic and ethnic groups. Members of poor minority groups, particularly immigrants, tend to be at a greater risk for developing generalized anxiety disorder, and this may be because of problems adjusting to a new culture, feelings of inferiority, alienation, or loss of strong family ties. Depression. Generalized anxiety disorder often occurs with depression, particularly major depression or chronic mild depression. And adolescents with depression seems to be particularly at a risk for developing GAD in adulthood. Coming on to the cultural factors, anxiety rates among children and adolescents have significantly increased, and Different studies they suggested that anxiety was related to lack of social connection and a sense of increased environmental threat. Coming on to the stressful event in susceptible people, the initial appearance of generalized anxiety disorder often follows a highly stressful event such as the loss of a loved one, the loss of an important relationship, the loss of a job, or being the victim of crime. History of self harm. Adolescents who engage in self harm by age 16 are at a higher risk for a diagnosis of anxiety by young adulthood. Diagnosis and clinical presentation. Generalized anxiety disorder is usually diagnosed when a person experiences excessive anxiety and worry for a period of at least 6 months. Along with the excessive anxiety, the person also shows symptoms of difficulty in concentration, irritability, feeling of restlessness, easily fatigue, and difficulty in falling asleep. With this, I have come to the end of today's presentation. Remaining type of the anxiety disorder will be continued in the next presentation. Thank you.